Hi, everyone. Welcome to the American Indian Cancer Foundation's webinar on cervical cancer screening program practices in Native communities. We're just going to take a minute or two to finish setting up. In the meantime, I am really grateful that you are all here. Go ahead. Okay, so I guess we're going to get started. Welcome again to the webinar with the American Indian Cancer Foundation. This is the Cervical Cancer Screening Program Practices in Native Communities webinar. I am Misha LaPlante. I am the Cancer Programs Project Manager for the American Indian Cancer Foundation. I am a community member of the Bay Mills Ojibwe Indian community in the Upper Peninsula of Michigan, as well as a Blackfeet Nation descendant. And I am happy again to be in this space with all of you to present on cervical cancer screening program practices. For those who do not know, the American Indian Cancer Foundation is a national nonprofit organization established to address tremendous cancer inequities faced by American Indian and Alaska Natives. Our mission is to eliminate cancer burdens on American Indian and Alaska Native people through education and improved access to prevention, early detection, treatment, and survivor support. Our vision is a world where cancer is no longer a leading cause of death for American Indian and Alaska Natives. Through hard work, culturally appropriate, community-based programs, and policy change that affords Native people access to the best prevention and treatment strategies, we see a day where American Indian communities are free from the burdens of cancer. I also want to make sure to mention that this presentation is funded by a collaboration with Minnesota Department of Health, SAGE Systems Change Work, and SAGE Plus screening programs. We are really grateful for their involvement in this opportunity to present to all of you about cervical cancer screening. So some housekeeping items. We are recording this both through Facebook, and we will also be sharing this and uploading to our YouTube channel. If you would like, please share your name, organization that you are representing, your tribal affiliation, and land acknowledgement / ancestral lands that you're on in the chat, whether or not that's through Facebook or through Zoom. Only if you're interested, of course, as well. For presenters, which I guess just is me, please be sure to mute your microphone. I'll try to do that in the off period that I'm not talking. If you have any questions, please feel free to ask those in the chat box, and we'll try to answer them all at the end of the presentation. And if you have any questions in the future, please feel free to connect to AICAF at health@aicaf.org. So our objectives today are to discuss cancer burdens in Indian country, including cervical cancer rates across Indian country and cervical rates in Minnesota. We will also be reviewing cervical cancer screening program evidence-based interventions, including provider reminders, provider assessment and feedback, client reminders, reducing structural barriers. In addition to that, we will be offering ways to tailor these cervical cancer resources to Native patients, and we'll be expanding on cervical cancer prevention and Indigenous lifeways. So before we get started, I really wanted to ground this presentation in understanding kind of some of the values that AICAF brings to our work. And so this is a really beautiful illustration of those values, including interrelatedness, nonlinearity, lifeways rooted in culture, balance, respect for all living things, and sustainability. I wanted to bring these values into the conversation today because, again, this guides the work that AICAF does. It guides in many ways guides maybe us as individuals and guides many of our communities as well, since we know that we share many of the same values kind of across tribal nations and Indigenous communities. Similarly, or I guess expanding, going deeper on that, I wanted to mention these because these values are things that you'll see specifically pop up throughout kind of our understanding of the healthcare system, how we interact with patients, our survivorship programming, all of those things across the board. And related to that is this question that really guides the work that I do, as well as the work of my colleagues, and is how do we support the patient, relative / community members to make decisions on their health that best reflect the person, relative, ancestor they are and want to be. As I had just mentioned, one of the values that we have is sustainability, with kind of our overall health and well-being practices, which can be reviewed or regarded across multiple spheres. So our individual sphere, family, community sphere, so on and so forth. Helping an individual be sustainable in those practices is really based on what they believe reflects the person they are and want to be, reflects their health and their well-being. So that kind of question is going to be guiding us throughout the rest of the presentation, but now I'm going to get a little bit more technical and talk about cancer in Indian country. And so this kind of image comes from our cancer burden booklet. If you haven't seen it, I strongly recommend reviewing it on AICAF's website. So for Native women and Native men, cancer is some of the top leading causes of death. For women specific, number one cause of death. And for men, it is actually the second leading cause of death. The most common cancers among women, Native women, are breast, lung, and colorectal cancer. For men, the most commonly diagnosed cancers are prostate, lung, and colorectal cancer. For both men and women, lung cancer is the leading cause of death, followed by prostate, colorectal, and breast cancers. And then we have this image here that kind of shows that distinct patterns in the American Indian Alaska Native cancer rates are observed across 6 geographic regions defined by the Indian Health Service. Of course, we know that is because many of the communities in these areas oftentimes have similarities, or they do not. I also want to point out that sometimes these communities are marketed certain maybe carcinogenic activities or products differently than other communities. So cervical cancer rates across Indian country are higher among Native women compared to white women. Staging is also more distant and regional. So in other words, that means that staging is often, Native women are diagnosed in later stages when it has metastasized. Rates among Indigenous women are also elevated in all purchase referred care delivery areas except for the East and the Southwest. And unfortunately, among our relatives, screening is particularly low among women who have access to Indigenous health services, Indian health services, with only 55% of women between the ages of 24 to 64 up to date on screening in 2017. And related to all of this, of course, is HPV. We know that HPV can prevent around 90% of HPV-related cancers. And unfortunately, we see that the vaccination rate is only around 60% for Native adolescents. These figures both come from a study by several different researchers that are really wonderful, studying the HPV vaccination and Native Americans protocol for a systematic review of factors associated with HPV uptake among American Indians and Alaska Natives in the USA. We also have some of these figures come from the American Cancer Society Facts and Figures 2022 Special Report, Cancer in the American Indian Alaska Native Population, which is a resource that I refer to oftentimes in my work. So within Minnesota, we see that incidence rates are highest for American Indians and mortality rates are highest for Asians. Our Native women are the most likely to develop cervical cancer in Minnesota. For instance, during 2014 through 2018, they were twice as likely to be diagnosed with this cancer as non-Hispanic white women. And Pap tests are around 75% for Native women within Minnesota, and they also happen to be highest for college graduates. Going back to Pap tests being around 75%, that is, of course, higher than we kind of heard earlier, but it is still not 100%. And of course, that's what we would like to see, or we would like to see it much higher than that even. So again, this is kind of just talking about some of those rates that we just saw. So here we can see again that American Indian women are receiving pap tests around 75% or so, or maybe a little bit higher than that. And then Native women who did not receive a pap test within the past 3 years, it is much lower. And I kind of just wanted to point those differences out because again, we're seeing national versus more regional or local differences. And so again, it really just depends. Kind of moving on, one of the reasons that AICAF is having this conversation today is because we have our Turquoise Thursday awareness campaign going on. Our Turquoise Thursday awareness campaign is surrounding cervical cancer awareness for Native people. So our team really invites Indigenous people and other organizations, other people to join us by wearing Turquoise Thursday and jewelry and photos on social media with the hashtag Turquoise Thursday. And in part, I just want to underline again that Native women are nearly twice as likely to develop cervical cancer compared to white women. And not so much that there's a differences there, but just noticing that there's a lot more opportunity that we can do with our Native relatives to make sure that they're getting screened. We would like all people to be screened. Moving on, with Turquoise Thursday, we really aim to educate people about the importance of early detection and remind women as well as all relatives to stay up to date on their cancer screenings. So as I had mentioned, I'm going to talk about some of the screening practices that we have. The bulk of my time will probably be focused on the first three, so client reminders, provider assessment, and VIVAC, and provider reminders, as well as talking a little bit about reducing structural barriers. So this is a very text heavy slide, but I wanted to make sure that I wasn't making too many slides. And so these are some ideas that we've actually done with clinics across Indian country before. And so we were really thankful to have some of their insight as to what works, what doesn't work. I know probably many of you listening in already do client reminders of sorts. And so in part, these conversations are just to expand what could be done with cervical cancer screening reminders. So AICAF has worked with clinics in the past to do postcards, phone or telehealth calls, emails, as well as text messages. There are also many other opportunities. And so if you have other ideas on ways that you do client reminders, please, again, drop those in the chat. I would really love to hear them. One thing that we know often works for people is making sure that they're recognized for making sure to get screened. And so sometimes that looks like making sure to pair it with a goodie bag, especially something or items that assist with the screening. So for instance, AICAF knows the impact of like how cold some of those rooms can be. And so we mentioned that socks would be really nice. We know heating pads would be really nice. Ice packs could be nice because sometimes those screenings are not always the most comfortable. And pairing items that help with the screening can kind of encourage the person to follow through with the screening. You know, if you're prepared, or the more prepared you are, the easier it is to kind of sometimes make a decision, feel empowered to follow through with the screening. And then at the end of it, you have items that you know will help get you through it. In addition to the client reminders, we know that on top of just reminding people about their existence, that it's really important to send with additional educational materials that discuss signs and symptoms, the benefits of screening, and ways to overcome challenges to the appointment. So again, with the discussion on overcoming challenges to the appointments, that could be directly related to whatever you put in the goodie bag, you know? So maybe that would be talking about like, hey, we know that there might be some pain at the end of it. So here's a heating pad or here's an ice pack. In addition to all of that, while you want to make sure to talk about it, you also want to make sure to have someone to talk about it. And so that could be having a nurse navigator, a community health worker, other healthcare staff to make sure to follow up, answer questions about the screening, or even about scheduling the appointment. Sometimes that's a consideration too. And we know, kind of as I mentioned earlier, that multiple messages and multiple mediums are really, really important. So sometimes it can be easy to get kind of locked into one way of doing things. So maybe, for instance, doing a printed postcard. But we strongly recommend that you or other organizations kind of branch out and try many different options. So kind of stacking and layering those screening message reminders. And on top of all of this, sometimes we also have seen that it's really, really important to make sure that you're tailoring the cancer screening education to specific patients. And we recognize that sometimes clinics, healthcare systems just don't have the capacity to do that. But in any like small, tiny way that we can do that, it is really, really helpful. So what that might look like is, for instance, if you are making a phone call, you could have a conversation with that particular relative about maybe prior questions that they had had in the appointment regarding cervical cancer screenings, and then kind of build off of what they had mentioned in that. So in this case, for instance, just making sure to circle back on the concerns so that, again, we're providing and equipping them with more knowledge at the kind of beginning stages of their scheduling process so that they feel more prepared again when they're going into the room. And so here is actually AICAF's printed / digital virtual or digital / virtual postcard reminder for cervical cancer screenings. We were really, really happy to have an artist work with us on this. And as you can see, we have our hashtag at the top. We have a variety of relatives who are across the generations, that represent kind of some of our moms, our aunties, our relatives, our matriarchs in the community. And then at the bottom, we have hashtag get screened for cervical cancer to kind of let people know what is going on. And then that QR code at the bottom of the Turquoise Thursday postcard, cervical cancer screening reminder postcard, takes you to AICAF's website. And then this is the back of the cervical cancer postcard. And so as we had mentioned, tailoring the message to patients, so sometimes that can be individual or it could be kind of like a community population. In this case, of course, we are trying to tailor Indigenous relatives. We have a statistic at the top about how Native women are affected by cervical cancer rates at higher rates, and that they're nearly 2 times more likely to develop cervical cancer. Another thing that we also really, really like to emphasize, as I'm sure many people do, is that cervical cancer can be prevented. And it is oftentimes very highly curable when it's found early through screening. Other things that we are making sure to mention are like ages, how often to get screened, and then kind of who to talk to. And so this postcard is actually available for all communities. If you're interested, again, please feel free to follow up with health@aicaf.org, and we would be happy to send you a virtual copy of this for your own clinics. And then I should mention, so here's the postcard. On the right side, we see here kind of like these several lines, and that's to write the patient, community members, name, address, all of that down so that you can send it out. And then if you wanted to, you could further tailor that postcard if you wanted and write a little message at the bottom. Following up with kind of client reminders and how I said that it would be really helpful to have additional educational information on top of that is this example of AICAF's Turquoise Thursday cervical cancer screening pledge. We have a few different variations of this. I'm only including this particular one for people who have gotten screened because I just wanted to give a short example. But this is designed for someone to fill out and probably post on social media. So for instance, they could just kind of hold it up and say like, hey, I got screened on hashtag Turquoise Thursday. I'm up to date with my cervical cancer screening because. So for instance, I believe when I had filled this out, I had written, I'm up to date with my cervical cancer screening because it is really important for me to set a good example for my sisters, my siblings, and my friends, my family, in making sure that I'm getting regular screenings, regular checkups, that kind of thing. In addition to that, I also really regard screening as kind of like an ancestral practice, or more of like a modern ancestral practice. And one of that, instilling those values again within myself, and hopefully maybe encouraging relatives if they need that around me to get screened as well. And so this kind of cervical cancer pledge, you can anything like that. I might even actually just print off examples of these, put them in the clinic, and then have them available for patients to fill out. Other things that you could do if you were really compelled and you're a community member listening in is to print it off, do it yourself, and or print it off for other people so that they're also kind of staying mindful of those opportunities. Um, and so this talks a little bit about everything that we already talked about. As we have mentioned, we work with clinics across the country, including Oklahoma City Indian Clinic at one point in time, and they actually presented on all of this in an earlier webinar. And so I just kind of wanted to shout them out for how wonderful they have been in the work they have done. And so moving on to a totally different evidence-based intervention, I'm going to focus a little bit on provider assessment and feedback. So provider assessment and feedback, I like to tell people, doesn't have to be so serious. As you might have seen in brief, the previous slide from Oklahoma City Indian Clinic mentioned this idea, and I can actually go back, mention this idea of hosting a friendly Papapalooza competition with a traveling trophy. And so that's an opportunity to talk about kind of like how providers, how healthcare staff are doing in making sure people are getting screened. And so you can share it in a really fun way that engages people, can motivate people to be reporting on that monthly screening goal and then the actual outcome. Related to that, you can have additional opportunities on top of that. So it could be a one-on-one meeting with relevant staff, it could be team huddles, it could be those team competitions, as I mentioned. And then, of course, you can kind of give feedback through prizes for the winning team. And of course, making sure to share both the goal as well as the actual outcome. Again, if any of you have ideas about how you provide assessment and feedback with your teams that are not listed here, please make sure to share that, because we are always interested in learning more about ways that you can kind of tailor these. One thing we also like to think about with kind of some of these activities is like, how can we bring back some of these Indigenous values that I might have mentioned? How can we bring back some of the lifeways or the traditions, the practices that we have? And so I'm not too familiar with clinics that have done this before, but for instance, an idea might be at a staff luncheon that might be focusing on cervical cancer, or just kind of like cervical cancer, I guess, anatomy, or essentially foods good for your cervix, good for your uterus, that kind of thing, is to have a conversation about cervical cancer. You could, and then make sure that you're talking about the goals, the outcomes, as well as like ideas about how to make this whole process better. And that's really kind of the feedback part, is like, how do we make sure that we're making these activities relevant to our communities? Very closely tied to all of this is the idea of provider reminders. So oftentimes a conversation in which you're discussing assessment and feedback serves as a reminder. On top of that, though, you can do manual or electronic reminders, which of course we know many of you are already doing. and also understand very well kind of like where the process is. Um, Again, we are curious about learning from all of you, kind of how you engage these evidence-based interventions and tailor them both to your clinic as well as tailor them to perhaps Native staff, um, or if you're working at a tribal or Native clinic, tailoring them above and beyond that with those Indigenous lifeways and practices. So regarding structural barriers, this is, of course, a big question for many, many communities, especially clinics, organizations, communities that are often under-resourced. It's how do we address those structural barriers? By and large, I imagine that many of you are very well familiar with the barriers that occur in your community. Oftentimes we have conversations about transportation, child and dependent care. We also talk about health literacy, environment accessibility, and of course, administration. Um, with all of this, understanding what those barriers are is really important. And then a big consideration too is capacity for implementation in the short and the long term. Um, so what can you do kind of like within the month? What can you do within 6 months or within a year? And then are there ways that you can make sure that those changes are implemented either from a policy, a clinic policy or organization lens, a systems change, or an environmental change to address the structural barriers? Other really important considerations, of course, is making sure to have the appropriate staffing. Um, you might want to consider partnering with other organizations that might be able to provide some of these services, or to start a pilot program. With a pilot program, you could launch a short-term project with evaluation to demonstrate measurable benefits for activities that reduce structural barriers. So with a kind of speaking more on some of these particular topics, with with reducing the barrier of transportation, you could work with local transportation companies. Sometimes we have seen that state health departments, for instance, the Minnesota Department of Health, have transportation available for patients that are involved in their screening programs. And so making sure that that information is kind of front and center can really help to reduce those barriers. Of course, we know that gift cards are really helpful and depending on your funding are not always available, but we do like to advocate that if and when it is available for places to do. Kind of an idea that we've also been thinking with these barriers is, again, kind of what are some novel opportunities or ways to make it easy on staff as well as the organization, with organizations or with a partnership with an organization that is already doing some of these things. So for instance, would it be an opportunity for your clinic to maybe partner with youth programs to get caregivers screened on a certain day while their youth participates in the program? So I'm kind of thinking about maybe an after school program, for instance, where the after school program and the clinic kind of gear up and say, hey, we really want to make sure that the women or the mothers, the relatives who need cervical cancer screening have an opportunity. And we're going to like extend our hours or maybe change kind of our process up for the day to make sure that we can focus on the relatives of this child in this youth program. And then you can kind of market it that way. So that's really kind of how do you bring other organizations or programs in and making it easier for everyone, as well as maybe even more engaging. I think related to that, it would be really important for a youth to know that their relative is getting screened, or just to see that like there is an emphasis on health. I'm not going to go into health literacy too much right now because I'll certainly be talking about that and more in a little bit. As far as environmental accessibility goes, one thing by and large that we know that we're seeing more and more across the country is making sure that our spaces, our physical spaces, are more accessible to our patients. our community members. And so sometimes, and these are just a couple ideas of certainly there are many others, is to rearrange waiting rooms so that they can accommodate wheelchairs and other mobility aids related to cervical cancer screenings. If you know that a patient has a mobility aid of some sort, we strongly recommend having a conversation with them about what would make them most comfortable in that screening so that they can, again, one, feel comfort, just have more education on kind of how that's going to go, and overall, hopefully deepening our relationship with them if that isn't already there. Another idea is just to create easy to see signage at the appropriate level and in the correct spot. So appropriate level really just means like physically, like um, maybe for adults, like because we're focusing on cervical cancer screening, is that more like at the level of the community members that you're seeing? Are we sharing these signs, these flyers, that kind of thing in areas that we know people with cervixes, women are going to be hanging out more often, that kind of thing. Another thing that I really want to point out is to make sure that the signage represents the diversity of your community members, including those who have disabilities, are Two-Spirit, LGBTQ+, and have other intersectional identities. Oftentimes, we might not have conversations about, again, these identities that other people hold, and therefore are not making the screening perhaps the easiest or most accessible to our community members. And we want to make sure to do that. So just really considering how we can all do that more is going to make a more inclusive world for all of us. As far as administration goes, we know that there are many opportunities within the administrative side of things. And we also, again, I just want to mention that we know that it can be a big stretch for our clinics, our organizations, to have to facilitate some of these solutions to the barriers because the resources just are not there. And that is, of course, we know by design. But related to administration, making hours more flexible can sometimes be really helpful. So, for instance, women who are working during the day just do not have time, or I should say women and relatives who are working during the day just might not have time to get screened. And so maybe extending those hours, offering hours on the weekends, that kind of thing could be really helpful. Perhaps offering another location or maybe partnering with another clinic to get patients screened if they're living in that area could be helpful. Reviewing paperwork is also another big thing, and certainly conversation we've had or I've had um, with different organizations is like, how do we make sure that people don't have to fill out 1,000 forms? And there are many other administrative opportunities on top of this. Again, I want to mention that we know that sometimes there's just not capacity to address the barriers in the ways that we want to, and that we are so thankful for all of the work that each of you is doing to improve the life and well-being of our Indigenous relatives and communities. Again, I wanted to touch on HPV a little bit, kind of shifting topics now. So that was largely the focus on evidence-based interventions. I'm going to shift to HPV as well as to some of these resources. Um, One thing that can be done with resources as well as conversations with signage, any of that is to also, again, just let people know about HPV and HPV vaccines. We know it's a problem among Native communities, as we've seen it kind of being a problem or an opportunity area among all communities. One thing that we do like to emphasize is that the vaccine is available for people up to age 45. We know that each clinic health system oftentimes has their own kind of perspective on whether or not to discuss this with people, certainly because the opportunity for preventing cervical cancer goes down at different ages. But we do see that there is an important opportunity to target adults. And also more research needs to be done on the effectiveness of this. Kind of like, what is that sweet spot? What is the population, time, that kind of thing? Who is the audience that would qualify for this specific target? Related to all of this, I just wanted to mention that ACAF does have resources for HPV or on HPV directed at youth as well as adults. In fact, we worked with a clinic to create a poster for HPV vaccine. Again, knowing that each organization, community has their own perspective on whether or not they kind of want to lift that message up. But in some ways, having the most information is helpful. And maybe it's something someone wants to change or do in their life. And they should have that opportunity. On top of all of this, I do also want to note that getting the vaccine for adults can there could be many more questions, especially related to insurance. So now I'm going to talk a little bit about tailoring cervical cancer resources specifically. Some of this might not be new to any of you, but some simple and clear tips that we have is to make sure to include statistics on Indigenous communities and relatives. Make sure that the verbiage is inclusive. So not just mentioning how women need to get screened, but how relatives with cervixes across the board really have an opportunity to get screened for cervical cancer. Related to that is making sure that these resources are culturally representative. So making sure that the images and graphics on there are reflective of your community, using tribal language, including words or phrases, or perhaps the whole resource. Would love to see that at some point. Again, making sure that these resources are inclusive, that they speak to the values of the community, and there's so many more kind of like tips, but also just like little insights that we can offer. And so I'm going to kind of talk about how AICAF has done that with our resources. And so here we have my PAP tools. This is one of our most, what would the word be? This is a resource that people get the most excited about. And so with this, we have a beautiful illustration done by a Native artist that shows the different tools that are involved in a PAP screening, and also kind of like what it looks like when you are getting screened. Again, this kind of information is to equip patients with the knowledge that helps empower them to get screened, but also to feel safe perhaps in their screening. And so if you're getting screened, you're probably going to want to know what happens with your results. What do my results mean? And so we have another resource that develops or discusses this. I want to point out, so when we had said to kind of tailor these to Indigenous communities, specifically with a statistic or of some sort, you can see at the top, we have that Native women are nearly twice as likely to develop cervical cancer compared to other racial and ethnic groups. We talk about the idea of Turquoise Thursday a little bit, or we have at least the hashtag on the bottom. The resource is also turquoise to kind of stay within that theme, which is a part of branding. On this resource specifically, it says, according to national guidelines, all individuals who have a cervix should get screened, including transgender, gender nonconforming, and two-spirit patients. And so, again, focusing on kind of decolonizing the gender binary, or claiming our gender expansiveness, and making sure to really honor Indigenous perspectives on gender is important. And we were able to kind of make that a point here on this resource. And then on the bottom, kind of as I have mentioned throughout this, giving people as many resources or as much information is also super helpful. And so we have a couple different resources for places that community members can contact. In the spirit of helping create safer spaces for our relatives, we also created this survivor sovereignty resource. And this resource is about kind of all cancer screenings, but was particularly developed because um, cervical cancer screenings are incredibly intimate, I guess. I mean, depending on your perspective, but also just like they really are. And so it can be a lot to um, get a cervical cancer screening done or any cancer screening. And so again, this resource kind of discusses all cancer and some of the things that you can advocate for your emotional and physical health. Again, really trying to make sure that we're kind of asking ourselves that question, like, how do we make sure that we are empowering the relative to make the best decisions for their health, um, both for the person they want to be as well as the ancestor they want to be. And so here we have kind of knowing what to expect with your cancer screenings, and then some specific tips. So for instance, asking your healthcare provider to explain why each step of the screening process is necessary. Sometimes that's really, really helpful. Making sure you can know that you can ask questions. Um, an amazing elder had presented at a conference that I was at a couple months ago and had mentioned that they didn't know that they could kind of ask for different with their healthcare team until their spouse did it. And that was really life changing for them because they were like, wow, I can actually ask questions. And so having a reminder like that sometimes is really helpful because depending on how you've been brought up, especially within whatever community organization, or I should say community organizations as well. We know organizations lead the way for programming, but with it, when whatever community, family, society perspectives, all of that, sometimes you just don't know. And so again, making sure that our relatives know and have the resources um, is highly important. Other things that we have on here is to advocate for your physical sovereignty. And so oftentimes we consider sovereignty from the perspective of indigenous sovereignty or from tribal sovereignty, really understanding the need for nation sovereignty, government to government relations, that kind of thing. In within that though is understanding that our relatives, especially as Native people, we have our own sovereignty that we can reclaim and need to reclaim that needs to be honored. And so part of that is also knowing that we can advocate for ourselves. And we have a number of things here. So inviting a family friend or member to serve as an emotional support person during the screening, that might be really helpful. Reminding yourself that it's okay to take care of your health is another way to celebrate your body sovereignty. You know, there are many opportunities for that. And so really thankful that this resource exists. Um, and really, really thankful for all of the people that were involved with drafting this, as well as kind of how it will expand in the future. These three resources that I've kind of pointed out are all on AICAF's website and are available for download. So again, this is another kind of cervical cancer resource that we have that kind of just talks about ways that you can hopefully, or ways that you might be able to prevent or be proactive with your health. Includes information on some of those screening tests as well as some of the statistics. Again, it follows kind of the branding for Turquoise Thursday and offers a little bit of advice about like the kind of results at the end. Another kind of opportunity is to really consider kind of like the medium that you are targeting patients. And so all of the resources that I just showed were primarily for printed distribution or virtual distribution if you have that too. But this resource in particular, the square slide deck that we have, is meant to be shared virtually, particularly on Instagram, which uses the little square boxes. And so we have a square slide deck here that talks about cervical cancer rates, that kind of thing. And you can kind of flip through the slide deck, for instance, and have multiple kind of like within that versus maybe just like one image, which is really nice. One thing that I really, really love about this slide deck is that it includes quotes from cancer, or I should say from Native cancer survivors across Indian country. So Eugene Flores had said, it's important for these young ladies to know how essential pap tests are. It can save their lives. And for me, that is just so humbling, I think, to know that our relatives are continuing to advocate for not just their health, but for the health of all Native people. Um, and I really believe that the ripples for this relative to share that knowledge continue to have an impact today. So I'm getting near the end. And going to kind of shift gears a little bit and mention that cancer prevention is often chronic illness prevention. And so while we talk about cancer prevention as making sure to prevent an initial cancer diagnosis, it's also aimed at preventing recurrence, additional cancer diagnoses, and other chronic illnesses like cardiovascular diseases. And that's really important, I think, to note with our relatives, because sometimes we perpetuate or can perpetuate like narrow pathways for understanding health by saying, oh, it's just one kind of health prevention. And actually, no, it's a lot broader than that. We know our indigenous lifeways, for instance, were very helpful across the board with protecting and safeguarding our health. And so making sure to really discuss that from a more holistic and broader scope is really important when we think about cancer prevention, recurrence prevention. On top of that, we also know that prevention efforts affect more than the individual. And so kind of again, understanding the interrelatedness of how cancer screenings work is also knowing that they affect more than just the person who is being screened. They affect the family, they can affect the community, they affect our tribal nations and our native communities, they affect broader society, and ultimately they affect future generations, as well as even past generations. And so making sure that we are kind of bringing that knowledge into the room as healthcare staff, as public health staff is important for our relatives, because it can offer more conversation. And here we have a resource actually that is on these Indigenous lifeways as prevention. As you had seen earlier, we had AICAF's values kind of listed on that slide. And so again, we have them here. And then we have our little turtle relative who has these lifeways kind of carried on their back. So making sure to engage with our traditional medicines, a natural diet, connection to nature, connection to community, tradition, and making sure to get daily physical activity and rest are all things that we know our ancestors practiced very well, and that really help safeguard our communities. As well as to really help to promote our overall well-being. On top of that, we have additional kind of more quote unquote modern ancestral lifeways that we can add today as maybe future ancestors. So for instance, getting regular medical care is really important. Making sure that we are getting our screenings is also important. Making sure we have an opportunity to get vaccinated if that's something we want to do is really important. And overall, just really engaging in safe behaviors or behaviors that will help keep us perhaps our bodies more healthy. For instance, like refraining from commercial tobacco usage is one of those safe behaviors or safer behaviors, and limiting or refraining from alcohol use can also be really helpful. I do want to point out that it is up to the individual to kind of decide what is the healthiest for them, and we really need to make sure that we are supporting them in those decisions to be the person that they want to be and that they are. So now that I've kind of gone through many of ACAF's resources, I kind of have them all listed here on top of the printed and digital resources that we have. We have um, a library of webinars on Turquoise Thursday and cervical cancer screenings, as well as HPV. We also have additional PSAs in there regarding HPV, for instance. And I highly recommend kind of checking those out, making sure to share them with communities if perhaps you don't have resources for Native relatives yet. Um, all of our opportunities for you. So kind of within all of this, or within this presentation, I've talked a little bit about ways to tailor like the overall message to Native communities. We also will be recording a webinar about conversations perhaps specifically to have when you're in the actual room with Native relatives who want to get a cervical cancer screening done. And that will be shared by the end of the month. Otherwise, will be available on our YouTube. So if you are interested in getting involved with us, or you have questions, or you are looking for additional technical support, especially related to screenings or other cancers, please feel free to contact us at health@acaf.org. And so now I see that I have a couple minutes for questions if anyone is interested. So again, please feel free to type those into the chat, or perhaps put them in the Q&A box if that's more your thing. I see that I have one now. Oh, okay. I see that the chat was disabled. So let me see if I can try to fix that. So sorry about that, everyone. Yes, again, feel free to type any of that in there. Or I should say perhaps in the Q&A box, now that I've noticed that the chat is disabled. Okay, well, I'm not sure if there are any questions. I'm gonna stop sharing my screen for now. Well, I'm really, really thankful to all of you for being here and talking a little bit about, or at least hearing about the hearing about cervical cancer screening program practices. If you have any questions that didn't get answered for some reason, please feel free to email us at health@acaf.org. If you're interested in partnering, please feel free to do that. At the end of the month, we will be sure to send out some of these recordings, as well as a list of links to each of those resources that you saw in there. So again, Shimigwich to each of you for joining, for the sacred work that you're doing to address cervical cancer in our communities, and just really helping to make sure that our relatives are choosing the best decisions for themselves and getting screened and reclaiming their Indigenous health. We are truly so thankful to be working with you, and are grateful again for your participation and your space, your energy here in our circle, in whatever way that looks. I'm wishing you all the best day, and ACAF is around if you have more questions. Chimigwech.